বাইপোলারের যে ডাইলেমাটা নিয়ে শেষ করেছিলাম যে বাইপোলারটা WHO বলছে বাইপোলার অ্যাফেক্টিভ ডিসঅর্ডার, আর আমেরিকানরা বলছে এটা বাইপোলার ডিসঅর্ডার। এটা শুধু অ্যাফেক্টিভ বলা যাবে কিনা, ইটস ডাউটফুল। ইটস ইন বিটুইন সাইকোসিস, স্কিজোফ্রেনিয়া অ্যান্ড অ্যাফেক্টিভ ডিসঅর্ডার। তাহলে এবার কোর অ্যাফেক্টিভ ডিসঅর্ডার জানিয়ে কারুর কোনো ডাউট নেই, আমেরিকানদেরও ডাউট নেই, ওয়ার্ল্ড হেলথ অর্গানাইজেশনেরও ডাউট নেই। সেটাতে ঢুকতে গেলে নেক্সট হচ্ছে ডিপ্রেসিভ ডিসঅর্ডার। এবার ডিপ্রেসিভ ডিসঅর্ডার, তাহলে ডিপ্রেশন এমন একটা অফট কোটেড, ইজিলি uttered word. Everybody says at every point, okay, I am depressed today. Okay. So it got a little bit diluted. But the significance of the illness is disability adjusted life years. Very good, very good, very good, very good. So DALY is a criteria set by whom? He said WHO. Usually everything is set by WHO or United Nations, but it is not by WHO. Can you please? Janish na, theek hai, honest. Janish na. No. Okay. So, this DALY is not by WHO or United Nations, any health organizations or social sector. It is by the financial sector. It is by International Monetary Fund. Okay. So, they consider disability in terms of work loss, in terms of financial loss. So, and they consider that depression is only second to the entire cardiovascular disorders being clubbed together in terms of DALY loss. So, if we consider in terms of health, there are so many illnesses which are more severe and causing difficulties of different degrees to individuals' personal life. But why it's been given so much of importance to depression? Schizophrenia is also more serious an illness. Because what we oft say, I am depressed, cannot be one of the most severe illness. Otherwise, people would not have said, okay, I am depressed. We don't say, okay, I am having cancer. We worry about cancer, but we don't say that I am having cancer. So, what we say depression and what is depressive disorder are not the same. And why it is even serious than the other illnesses is that this illness usually occurs in the productive period of life. Like schizophrenia, bipolar, they start much earlier. So when the person hasn't entered into an economic position. So adolescence to youth, second to third decade, 18 to 25. You are so anxious. Relax. You will get your attendance. Relax. Participate in the class. Today's attendance will be taken downstairs. Okay? Today there will be World Hepatitis Day celebration at the LT2 at 11. So spend there for 10 minutes to half an hour. Your attendance will be. So participate in the class. Okay? I am probably seeing your face for the first time. So on a welcome day, I don't want to see a very anxious face. Okay? It's distressing. All remain relaxed, okay? So depression usually starts in the later decades, in the middle age. In the young life, in this adolescence and this period or the extremes of ages, depression occurs. But usually it is in the 4th to 5th decade, middle age. And the middle age is a person is earning money. Suddenly he went into depression and he is not attending his work. So there is a huge work loss, monetary loss for the self, for the family, for the company. Person is not going for work. So that's a thing that DALY, it is very high, only second. Now another issue is like depression. Like we all say that I am depressed, and there has become a tendency to consume mood elevators on OTC basis. How many of you have heard of Prozac? Prozac. If you are a social media kind of a searching person, Prozac. Prozac. Okay, it is 2 decades back. Do you know Prozac? Prozac naam ta at least. Okay. Prozac was the first SSRI. You have heard about SSRI in your pharma class, selective serotonin reuptake inhibitor. The Fluoxetine. In US, the drugs remain patented to the company. So it came in the name of Prozac. So like over here we say phenytoin. In US they say dilantine. Dilantine. The brand which gets the FDA approval, that remains over a period of time before it goes into another company. So we can get so many fluoxetine brands, but in US it's not like that. And after certain years, the sale of Prozac becomes OTC, and it became the highest selling product. The way now it is being competed by Ozempic. Have you heard of Ozempic? Semaglutide. Weight loss. So, body image concern. So, Ozempic. Another is amoxiclav. It's not azithromycin. So, fluoxetine or Prozac became so much of sellable that people started thinking that, okay, serotonin is the answer. So now gradually, these days, if you are social media fan, you will see that posts are coming, oh, okay, doctors cheated us over years. Now a paper has come that it's only not, this is a more of a reductionist approach to say, okay, it's only serotonin. There are so many things which should talk about which leads to depression. Might be people are improving with Prozac. When US again sanctioned the OTC of Prozac, the rate of suicides got increased. So it's helpful, definitely it's helpful. Nowadays, over here the people consumes Nexito. Nexito plus, he even said. Okay, so it is so common. He told the Nexito plus. So it's like so many, every people, I take Nexito plus. Whenever there is anxiety, whenever any pressure, they take Nexito plus. So before going into depression, we should talk about something about the pressure in our daily life and the resultant immediate effect of it, the anxiety, for which we consume Nexito plus. Considering that probably which is actually an antidepressant. So before we go into depression in the structure of our nosology, DSM or ICD, first the real life situation, that is stress, anxiety, depression. Now what is stress? Pressure, I told. So, mone ache physics? Stress, mone ache? What?
F by
F by A. F by A. তাহলে সেটা কি হলো? তাহলে পার ইউনিট এটা কি?
এরিয়া।
এরিয়া। তাহলে F ফোর্সটা এলো, সেটাকে যদি প্রেশার বলিস, তাহলে তার থেকে যে এটাকে মেনটেন করার জন্য, ডাউনওয়ার্ডসের জন্য যেটাকে সে টেনে রাখে, দ্যাট ইজ স্ট্রেস। নাথিং মোর দ্যান দ্যাট। ইন লাইফ অলসো দ্যাট ইজ স্ট্রেস. Think that this is something mental, some negative events. It's not like that. some added pressure to your life. It may be positive. Till today you are not engaged or you are not a couple. Tomorrow you are a couple. It's a stress. You will have to go attend. There is a pleasure, but at the same time you have some added responsibility. You are married, added responsibility. You got a job, added responsibility. It's not a loss of a job, only stress. She came late is a stress. But the people who are so sincere that they will come only at 9, that's also a stress that builds up something. Until and unless it becomes very coped within the system, that it will happen. That's a stress. Whichever comes suddenly, which is not in the homeostasis of the system, suddenly comes as a pressure per unit area, is a stress. You are feverish today, is a stress. So how this stress operates? So when there is an extra load, the strain occurs in the string pool. So your body is the string. So that will try to recuperate the additional pressure. So by what? Immediately. Immediately what you need? To fight off something, you need something. What do you need? You need to fight off that additional stress. So when you need to fight, what do you need to? What do you need within your body? No, alcohol is an external agent. Immediately. Dopamine, serotonin is coming, they cause something different. But immediately what you need? Adrenaline. Simple. So you need more blood. You need to pump. Learna hai na pump. So what will pump? Adrenaline pump. So adrenaline from the hypothalamus. Then to the sympathetic system. Fine. Immediately adrenaline. Good. Immediate. In the long term, we need to make our metabolism also ready for it. So, what is the pumping thing for metabolism? Steroids. So, then this adrenal is the medulla, then the adrenal cortex. Steroids. Now, what is we are fighting, if we say another word in place of fight, it will be easy to get the clue for you. What is fight? Fight is a defense. It's not always offense. So for defense, what is required? Immunity. So steroid and immunity. So humoral immunity, cellular immunity. So they need also to be pumped. So they need to be changed into their positions. Okay, something new has happened. So these are the areas that stress will cause to us. They will immediately pump adrenaline. They will raise our corticosteroids level and they will shift some immune status. Both humoral immunity as well as cellular immunity. That's a little bit complicated to discuss. What are the exact changes in the immunity? Because that's not so linear. Now, what will happen? So that is what is stress. That is the preamble of the person going into a depression. And these are the areas where you need to finally act upon. And these are the areas through which the symptoms will also appear. Now, adrenaline. So, adrenaline is sympathetic nervous system. So, start from head to foot. Say, adrenaline from head. What will cause adrenaline in your head? In your head or face? Adrenaline, the time taken by you is more for an adrenaline to talk about. Adrenaline is immediate. Anybody? 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 Adrenaline. Face. Meiosis in the eye. So, people are constricted. So, we are focused. We need to fight off. No? There is an evolutionary explanation of it. Why? Why adrenaline? No, we need to focus on something. People dilatation is, you see long. Salivation, dry mouth. Whenever there is a fight, whenever anxiety, you are feeling it, right? So dry mouth. Then focus. You need to fight it off. Then face, muscles.
Muscle contracted.
So what it will be? Contraction, what it will be? How the face will look? Flush is not muscle. Flush is kind of a vascularity. Muscles, either this or this clenching of it, at times teeth grinding. So people are coming and saying they are having mouth ulcers. Coming to the OPD and saying mouth ulcers. Do you do teeth grinding these days? Are you anxious? TM joint pain, always clenching teeth. Then, what will happen with the flushing? What will appear over here? Sweat. Simple. So, sweat will appear through adrenaline. Sympathetic, cholinergic. So, this is an exception. Sympathetic, everywhere is adrenergic. Sympathetic is cholinergic in sweating. Okay? Any other area where sympathetic cholinergic is there? Like in GI. What occurs when you are stressful? On the day of your examination, what happens? Yeah? Bowel movement. So bowel movement is by sympathetic cholinergic. Because anticholinergic causes constipation. Adrenaline is anticholinergic. But we have loose motion on a stressful, anxious state. So here, this sweating and this bowel movement, these are sympathetic cholinergic. You are not taking a note. Oh, so just as if tomorrow you will forget what is sympathetic cholinergic examples. Sympathetic cholinergic, just right now. So, from face, go, throat. So from throat starts what? Your here to here. What it is? Alimentary canal. The gastrointestinal system starts. What are the types of muscles? Longitudinal muscles and the circular muscles. So, all constrict করে যাবে তো যদি constrict করে যায় what would happen no increased bowel movement is something different. There is sympathetic cholinergic, more secretions, sphincter, this is the circular muscles. Then it will constrict all the sphincters. the esophageal sphincter, the gastrojejunal sphincter, but esophageal sphincter will relax. That sphincter will cause constriction, the lower gastroduodenal. Then esophagus, even in the longitudinal muscles, so there will be a heaviness, there is a kind of globus kind of a sensation. अटका हुआ है, गिलते पाच्छे ना जाना. If you are anxious, as if something is in the throat, often you have this, whenever you are sad, you feel something you cannot swallow. This is a common expression, I cannot swallow this. Because that is causing stress and anxiety within me. I cannot swallow it. It's not figurative, it is happening. This is constriction. And I am having heartburn, there is a chest tightness. All the skeletal muscles of my chest constricted. Diaphragmatic movement less. During anxiety, we respire through our abdomen. Chest exertion less. So, chest tightness. LES open, gastroduodenal constriction. Then reflux of acid, heartburn. Stasis, you are not feeling hungry. Your stomach is full. Next day, when there will be some hurry, there will be more secretion, you will have loose motion. So this is this. So, chest is not, the muscles, chest muscles and diaphragm is not moving that much. But you need to compensate it for your oxygen. So what will happen? Mouth breathing and rate will increase. Respiratory rate will increase to compensate for it. Anxious person. And while mouth breathing, there will be hyperventilation. More of carbon dioxide they will lose. The hypercalcemic tetany. They will feel muscles will be more constricted. Why? Because how? If somebody loses carbon dioxide, why hypocalcemic tetany? মনে হচ্ছে না তাহলে আমার কি হয় তাহলে অ্যালকালোসিস হয়ে গেলে OH হয়ে গেল টিটেনি কিসে হয় hypocalcemic tetany so the free calcium gets bound to OH so hypocalcemia then relatively hypersodium then it is more discharges we are having muscle spasms. That is because of hyperventilation. We are breathing like this. Breathing rate is increased, but breathing is shallow. Then to your heart, again, sinus tachycardia. But diastolic feeling is less. Even ejection fraction is also not high. So, less pumping, more rate of pumping. So this much. Bladder. What will happen with bladder? What happens when you are anxious? Vomiting through your bladder. So you are so anxious. Relax. Bladder is for breathing. Bladder for don't get anxious. Bladder for breathing is for chest and lung. Vomiting is your that stomach through esophagus. Bladder is bladder is urinary bladder. Okay, don't get anxious. This happens in anxiety. Remain relaxed. Pardon?
I have taken Fluoxetine.
Okay. Fine. So that's what happened. So, urinary bladder, that's what happens in the brain. Suddenly, it causes fog. We are going down, but you just think, without being any bias, this happens with everybody. That she felt anxious. So even she's unable. Is it for bladder? Anybody can say no, but over the brain. This is fog. We say in a brain fog, these things. So within the brain. Relax. Don't worry. I'm not here to rebuke you. Okay, relax. So bladder, there is a detrusor muscle for the sphincter. So what happens? It becomes hyperactive. So even without feeling, it gives you a sensation of urge. So you go to pee repeatedly. Or at times, that is a detrusor urge or sphincteric spasm. Even there may be kind of a fullness, urination is not happening. It can happen on the both ways. So rest is skeletal muscle. Bladder, then if you go back, that's the alimentary canal. This is what? This you experience in your anxiety. So this is the pathway the stress causes anxiety. And many of it you might experience when you are positive. You are seeing Argentina winning. If you are an Argentina supporter. So your heart is pounding, no? Or you are in rumors, dhaka karne laga. So it's not always negative. We give a very negative connotation to it. It's not always. Anxiety is simple sympathetic urge. Now what is the negative out of it is the worries. Worries are the psychological negative thoughts. Follow me, just follow me. Relax and follow me. Okay. Try to compensate your this overactive sympathetic system. So, we are talking about overactive sympathetic system. Can we anyway control our overactive sympathetic system? Is there any way? Because this is a very everyday concern for us, no? Beta blocker. So, she will not have beta blocker right at this point. She will not. What she can do? What anybody can do? We'll start yoga. Breathing. Who will be able to explain how breathing controls sympathetic? So somebody told you deep breathing helps. Box breathing. I don't know box breathing. So this is somebody has made a kind of a box, explained it to you. So how this helps you in improving your anxiety? That means the control of your sympathetic nervous system. Has it been clear to you? No. So let's understand it today. So in our bronchioles, there are certain stretch receptors which are connected to our hypothalamus, which send signals. They are called pulmonary J receptors. And in physiology it was there. And we should be proud about it that one Indian discovered it, Mr. Pentel or Dr. Pentel. So when it stretches, it sends signals to the hypothalamus to send sympathetic nervous system. And when it relaxes, then the parasympathetic nervous system. This is a pull. Like the way you can say a lung-brain loop. Now, you see, when any in the living world, anybody goes for fight, what the person does? That's the thing an individual does. To fight. So, pumps up. A bowler goes to the bowling mark, coming to crush the head of the batsman. Take a deep breath and run. Batsman casually just makes a shot, ball goes to the boundary. How the bowler returns? How the bowler returns? Frustrated is something psychological, the worry, frustration or something. Immediate bodily change. This is a bodily change. I'm not talking about how the thoughts are going on. What is the bodily change? What is it? How? That's how, no? The bowler is worked for a 6. When Sachin used to hit 1 for 6, one used to return. So that's a deep sigh. That raises the parasympathetic system to cool down the sympathetic system. So what deep breathing does, it's not, if somebody has said, make something like box, but the principle is you need to train your brain that whenever there is a sympathetic system, sympathetic arch, there should be a higher ratio of parasympathetic arch. And how natural breathing goes for these deep sighs. Always like, it's not like that, no. Always think of system what the nature has created. Nature hasn't created that for your blowing up your nose that you do. Nature has created you to, you don't open your mouth. But when you relax, and you do the deep sigh, this much only. When you take the deep breath, this much only. Because the deep sigh, so the signal that goes to the brain, that every sympathetic should be followed by double parasympathetic. You need sympathetic, but you need a double parasympathetic to get ready for the sympathetic to occur. Action potential, depolarization, then repolarization. It goes back, and that goes deep below. You remember the curve? Shoots, falls down, goes deep below to recuperate to again fire. Similarly, parasympathetic should be more to control the sympathetic. So, it should be like, anybody can do it at any point. You don't need to take a mudra. You don't need to squeeze your nose. Even if your class, people take cigarette in smoking. So, it's not only the nicotine that helps, the puff that helps. The more relaxed a person, the person creates more ring. That's the relaxation. So that helps. Henceforth, do it like this. Whenever you are in. Just cover your mouth. Nobody will understand. In your examination, suddenly you are not comfortable with the paper. You can't just sit. That will only happen in 21st of June, no? Not your daily life. Not in your daily life. वो दिखावा है. काम के लिए you can even walk. In your campus, you take 4 steps. You take 60. This is how you control your sympathetic nervous system. That you sense in the signal to the brain that whenever any situation increases your sympathetic nervous system, brain should immediately fire the parasympathetic nervous system. Your brain will be attuned like this. Similarly, heart gets attuned to like this for the athletes, what that is called. Huh? What? Athlete's heart. What is that? হ্যাঁ তাতে কি হয় মানে আলটিমেটলি হোয়াট হ্যাপেন্স রেস্টিং হার্ট রেট সাইনাস ব্র্যাডিকার্ডিয়া হয় দে ডোন্ট নিড টু ইনক্রিজ দেয়ার হার্ট রেট টু কম্পেনসেট ফর দ্য ব্লাড সাপ্লাই পাম্প করলে করলে কার্ডিয়াক মাসেলস হাইপারট্রফি হচ্ছে করে ভেগাস নার্ভটা যেখানে আসছে সেখান থেকে স্টিমুলেট করে গেল ভেগাল টোনটা বাড়িয়ে রাখলো সিম্প্যাথিক টোনটা সো হার্ট রেট কম থাকলো they don't do, but because they need to run, no, we run, our heart rate goes from 80 to 120. They need to run every day. Ronaldo is running, Messi is running at the 40, at the age of 40, 90 minutes overall. So they need to keep their heart, resting heart rate 50. It will go up to 70, 80, not much. Similarly, your brain will get trained that whenever there will be a sympathetic nervous system in your brain, a parasympathetic nervous system will automatically lock up. It's like something in a car. Do you know who knows? How many of you know driving? Bike you drive. Car you know. So there are two things, that two pipe comes to the engine. What are the two things? Air doesn't come. Two things. You need to refill it during your servicing. Two pipes come. Like. No, oil to holo it's the everybody knows. That's the fuel. Other thing. Like if there is no fuel, the car doesn't start. It is called cold stop. Or if the car is running, in between suddenly stops. I don't know whether you have seen, previously people used to see it in the roads, bus stops and they come, coolant, fuel and the coolant, two pipes. So sympathetic nervous system is the fuel and the parasympathetic nervous system is the coolant. Unless you will become hot stop, you will start, you will run and you will stop. You are very brilliant, you are doing good results, but suddenly, just before examination, you cannot perform. That's what happened in our life. We have fuel in us. We can start. We don't have cold stop. We have enough resources. We have our intellect. We have our motivation. But we become too hot at the time of our performance. So, we need coolant. And the car is such primed that there is a ratio that this much fuel will come, this much coolant must also come. So similarly, brain would also be tuned that if this much adrenaline comes, this much parasympathetic, if it's sympathetic, not adrenaline and cortisol, sympathetic, the ratio of parasympathetic will also come. So train yourself. Everybody train yourself. So tomorrow in the examination, it should not happen that you cannot open your mouth. The teachers are expecting, okay, let him speak something, even if wrong, let him speak. Brain fag. So, this is the stress, anxiety, and through which you are then progressing into, then along with it there are worries. What we call anxiety is basically they are worries, negative thoughts, apprehensions, what will happen. Then we enter into a state called depression. Now, depression is something which is all less. So, but we recognize it primarily with sad mood. Unfortunately, what causes sadness? If you see in the dictionary also, sadness is a psychological state that arises out of deprivation. You see so many, if you the persons who are going through treatment of depression, are they deprived of something? No. So often the sadness, the background to the sadness doesn't become clear. And if the background to the sadness doesn't become clear to the person around, not also to the self, so they don't recognize that, okay, I am depressed. Understand? You said that you are taking fluoxetine. So it's an antidepressant. For you, okay, fluoxetine also occurs helps in anxiety, for stress to anxiety or something. But if it had been, if we enumerate, enlist, check it out whether depression is also not there, you might also think, but why should I be depressed? I don't have any reason for deprivation to be sad. So often that is the catch-22 situation. The people who really depressed don't seek help for depression because they don't see that they don't recognize that I have a deprivation in my life. I'm having everything. But still the criteria is sadness. And that sadness should not be also sudden momentary sadness. It should be persistent and pervasive. In all situations I am feeling sad. Now how to feel sad? If it is not something taken away from you, then it has been, another pointer has been added to it. Okay, nothing has been taken away from you. But do you get the same pleasure and interest of the things that you used to get earlier? Yes, till yesterday you were getting chocolates, today also you are getting chocolate. But do you have the same taste of chocolate yesterday and the same? That's the way even to elicit sadness. Sadness is, if I say that it's taken away, often it will say, no, nothing has been taken away from me. But whether I am getting the same pleasure is another expression of sadness. Even all the positives that I am getting in my life, I am getting all the positives, but whether I am enjoying it or not, or whether I am getting motivated to go for the positives. Till yesterday I was always running. Today whether I am motivated to get for it. So that's the expression of sadness and not getting pleasure. Then there would be something, vegetative symptoms. Your sleep is disturbed. Your appetite is disturbed. You're feeling very weak. This is another complex. Previously, this feeling of weakness used to be clubbed together with the sadness as the core symptoms. That somebody must feel weak. In anxiety, there is no weakness because anxiety, the people are trying to fight it out. And in depression, it is depressed. The motivation is depressed. They don't want to fight it out. They are rejected now. Their thought is, my lecture is very relaxing for her. The individual is helpless, worthless, hopeless, all negative thoughts are accompanying. I cannot do anything. Mujhse kuch nahi hoga. And nobody is around me. So, negative thoughts, triad of negative thoughts. So, low mood, vegetative symptoms, triad of negative thoughts, anxieties, and certain somatic symptoms. Other than the anxiety symptoms. In anxiety, there is a palpitation, deep breathing, chest, loose motion. Another is very important thing is pain. Pain complaint. Even the pain, the word pain comes from this concept of being punished. P-A-E-O-N. Pain. From pain it comes pain, where there is an individual experiences punishment. So when there is a depressed state, anxious state, there is a punishment. What happens in our sensory system? There is a getting mechanism. We neglect so many things. For example, all of you are sitting on your butt and putting more than 50% of your body weight on your butt. How many of you are sensing that you are putting something, putting pressure on your butt? Any of you? None. So brain is neglecting it. You get up, somebody touches your butt. So brain is, that is called sensory getting mechanism. So the significance of the sensory stimulus is not the intensity. That this is something may be harmful to me or an unacceptable to me. Either an unacceptable prank or an harmful prank. Harmful gesture. So similarly, this sensory threshold reduces. So many sensory inputs going into our bodies. That causes pain. So another component of depression. And along with it, there may be that from loss of energy, there may be retardation, severity, when severity occurs, then there may be catatonia, distorted thought that I am hopeless, helpless, worthless. From there, if you extend it, if the thought goes into a delusional level, how many of you have heard of nihilism? Okay, it's N-I-H-I, nihi or nihil. Nihilism or nihilism. So, nihilistic delusion, nothing is around. World does not exist. So, nihilistic delusions, that the very common delusion, or even persecutive delusion, that I have probably done a sin, I have done a wrong, worthless, so I have done something wrong, I have done a sin, so police will come and catch, or that goon will come harm me or my family. These are the thought distortion to the psychosis level. Psychosis happen in depression. So if a person is talking about these thoughts of harm, you must look into first whether the person is depressed or not. If it is depressed, it might be, it might not be schizophrenia. And out of the hopelessness, there is no reason for me to leave. Suicide. That is the worst outcome of depression. So, with the worst I end.